Greetings, it's Dr. Hannock. So this is about joints, or better known as also articulations. Essentially, this is where two or more bones joint and interact with each other for the sake of stability and mobility of the body. There are two classifications. The first one is structural, in which three types are based on the material that binds the joints and whether a cavity is present. So the three are fibrous joints, cartilaginous joints, and synovial joints. The second one is functional classifications, and there are three types based on the movement the joints allow. So immovable joints are synarthrosis. Amphiarthrosis is slightly movable joints, and diarthrosis, those are the ones that are freely movable joints, better known as synovial joints. The structural classifications are more clear-cut, so we'll use those instead. So the first one, fibrous joints. The joint, in this case, the bones are joined by dense fibrous connective tissue. There's no joint cavity, and most of these are immovable. And it depends upon the length of the connective tissue fibers between the two adjacent bones. And we have three types of these fibrous joints. The first one is sutures, then syndesmosis, and gomphosis. So sutures, these are the rigid, interlocking joints of the skull. They allow for growth during the youth, and they contain very short connective tissue fibers that allow for expansion. In the Middle Age, the sutures essentially ossify and fuse, and they become immovable joints. Closed immovable sutures are referred to as synostosis. And here's the example of the sutures here of the cranium, the cranial bones. You have this very short, small, fibrous connective tissue between the adjacent bones. This suture is the squamous suture, lambdoid suture, coronal suture, what we can see here from this view. Next is syndesmosis, where bones are connected by ligaments and bands of fibrous tissue. And here the length of the fiber can vary, so movement varies. Short fibers offer little or no movement, and this would be an example of the inferior tibiofibular joint or distal tib-fib joint. Longer fibers offer larger amounts of movements, and here this would be the interosseous membrane connecting the radius and the ulna, which actually compartmentalizes the anterior compartment from the posterior compartment of the antebrachial region, or better known as the forearm. So here's an example of the syndesmosis. This is the distal end of the tibiofibular joint here, and here we have this ligament, the short ligament that holds it in place, and this is responsible for a portion of the ankle joint. Gomphosis, essentially peg and socket joint. Connection is periodontal ligament, holds the tooth in the socket, and here's the visualization of that. Next is cartilaginous joints. This is bones united by cartilage. Like fibrous joints, they don't have a cavity and not highly movable. And the two types are synchondrosis and symphysis. The synchondrosis, example of that, would be here, for example, the epiphyseal plate, which is a temporary hyaline cartilage joint. And here, as you can see, the joint between the first rib and the sternum, or manubrium here, which is immovable. The symphysis, example would be of symphysis here, hyaline cartilage also present as articulating cartilage on the bony surfaces. These are amphiarthrotic, which are slightly movable, and the examples would be the intervertebral joints and the pubic symphysis. And here on this slide we could see the intervertebral discs, where we have this slightly movable movement of the vertebrae, and of course the pubic symphysis that holds the two pubic bones together in the anterior aspect of the pelvis. Synovial joints, these are the most common. These are bones separated by fluid-filled joint cavity, and they are all diarthrotic, namely, they are freely movable joints. These include almost all limb joints. So they have 6 general features. They have a bursae, or bursa for singular, and a tendon sheaths associated with them. These are sheaths and bursa for resisting abrasion and frictional rub against 2 adjacent structures that are moving, usually in opposite directions. Stability is influenced by 3 factors of a joint, and they allow several types of movements, and these are classified into 6 different types of movements. So the general structure, basically, here's the verbiage of that. As far as the joints, it has an articular cartilage, which consists of hyaline cartilage, and the hyaline cartilage prevents crushing of bone ends. Then we have the synovial cavity, which is relatively small in volume, and it's filled with synovial fluid that lubricates the articulating surfaces. And then we have the joint capsule itself that has 2 layers. The first one is the external fibrous layer that's formed by dense, irregular connective tissue, and the dense, irregular connective tissue has the ability to resist tensile pulling in multiple directions. And the inner layer is this synovial membrane, which is loose connective tissue, and this is what creates and produces the synovial fluid. Synovial fluid, on the other hand, is this viscous, slippery filtrate of plasma. So the blood plasma is a component of the synthesis of synovial fluid along with hyaluronic acid. As I stated, it lubricates and nourishes articular cartilage, since its cartilage is avascular, and they also contain phagocytic cells to remove microbes and debris. So here are some of the things that reinforce ligaments. Capsular, which is thickening part of the fibrous layer. Extracapsular, which is found outside of the capsule. And intracapsular, these are deep to the capsule, which is covered by synovial membrane. And of course, we have the nerves and blood vessels. They detect pain, monitor joint position and stretch. And of course, the capillary beds supply the filtrate for synthesizing the synovial fluid. Here is a picture of the joint, a typical synovial joint, and you need to know this photograph, this picture, and be able to identify the parts of a synovial joint. This is a typical one. So here is an example of a bursa, which is found in the shoulder joint. So here, this is the humerus, and here is a ligament that's coming around, and this is the bursa, which kind of rolls along, and what it does is essentially it eliminates frictional rub between these 2 adjacent structures, namely between the ligament and the articulating surface of the head of the humerus. Next, these are factors influencing the stability of synovial joints. There's 3 factors. The first 2 are somewhat limited, and the third one is muscle tone. The first one is the shape of the articulating surfaces. So shallow surfaces that are less stable than the ball and socket, and these play a very minor role. Ligaments, the number and the location, it also has a limited role in terms of stability, although it gives the joint a little bit stronger than just the articulating surfaces. The third one is the key. This one's the most important. It keeps the tendons taut and they cross the joints. And this is extremely important in reinforcing especially the shoulder and the knee joints and the arches of the foot. So these are types of synovial joints. So there are 6 different types of synovial joints, and you need to know these. So the categories are based on the shape of the articulating surfaces as well as the movement the joint is capable of. So you need to know the plane joint, hinge joint, pivot joint, condylar joint, saddle joint, and ball-head socket joint. So here is the first one here, a plane joint. So here, a plane joint between the carpals, in between the carpals, which is called the intercarpal joints, or in the foot, intertarsal joints, and even between the vertebral articulating surfaces of the vertebrae. So that's there. It is a non-axial movement. So we have this gliding movement, and the surfaces, articulating surfaces, are flat. Next is a hinge joint. So the example being used here is the elbow joint, and it is a uniaxial joint. In other words, it only will pivot in one axis. And the movement is flexion and extension, and the elbow joints and the interphalangeal joints are a hinge joint. However, the interphalangeal joints or the metacarpal phalangeal joints are also do flexion and extension. However, they are biaxial joints. The next is a pivot joint here. So we have this annular ligament that wraps around like a sleeve around the head of the radius and holds the radius in place against the ulna. This is the proximal end of the elbow antebrachial region. So here, this is uniaxial movement. Essentially, there is simply rotation where the vertical axis runs along the length of the radius. So you could see this rotation, and this movement is responsible for causing pronation and supination of the hand. Condylar joints, again, these oval articulating surfaces, these are biaxial, as I mentioned earlier. Condylar joints, two axes of rotation, so it causes flexion, extension, and adduction and abduction. And the example is the metacarpal phalangeal joint, your knuckles, and your wrist joints. Saddle joint, here, this is biaxial movement between, excuse me, the carpo-metacarpal joint of the first digit. So here, it shows that we have abduction and adduction, flexion and extension with regards to the this saddle joint, the carpo-metacarpal joint between the thumb, the pollex, and the carpal bone. Finally, the ball and socket joint is a multi-axial joint, multi-axial movement causing a combination of all different movements, which is called a circumduction. Ball and socket, the articulating surfaces are such where one end is a socket, the other one is the ball. And we can do all types of movements there: flexion, extension, abduction, adduction, rotation, and finally, of course, circumduction. So this completes the basic overview of joints. Very basic. I would recommend looking at the images of the entire skeleton, and it's pointing out to the different types of joints based on the 6 different types of synovial joints and their movements. Hope this works. Take care. Thank you.